Yesterday, the president did convene a meeting with members of his cabinet and other members of his senior staff who are responsible for the response to this particular Ebola diagnosis and to the broader Ebola outbreak that has occurred in West Africa. Today, the president will meet with some members of that team here at the White House to continue these discussions and to follow up on some of the actions that the president directed out of that meeting. To be clear, what the president directed out of that meeting is a commitment on the part of the federal government to ensure that we're doing everything necessary to detect, isolate, and treat Ebola patients when they materialize at healthcare facilities in this country, and that we do that in a way that protects healthcare workers and the broader American public. That is a core priority. At the same time, the president wants to ensure that those efforts do not distract from the very important work that's being done in West Africa. Our experts tell us that the only way to completely eliminate risk from the Ebola virus to the American public is to stop this outbreak at its source. And that's why CDC officials have been on the ground in West Africa for 7 months now, dealing with this specific Ebola outbreak. And it's why last month the president announced a significant commitment of resources from the Department of Defense to lend their logistical expertise to improve the flow of personnel and supplies that are being used to mitigate the outbreak in the region.